As a Group Chief Operating Officer at PureHealth, I am very lucky to be working in an environment, in an industry that I feel so passionately about, healthcare. It has been not just a personal vision for me or a mission for me, but for our entity as well, to leave this world a better place than we came into. And I think if you're in healthcare, that's the best way to do this. And that's primarily been my focus as a Chief Operating Officer, to focus on disrupting the current healthcare industry, bringing about technological breakthroughs and transformation, changing that mindset of healthcare and taking it to the future. So every human being has a right to holistic healthcare. Now, what is holistic healthcare? Holistic healthcare is when an individual is delivered the best value-based healthcare from 360 degrees. So he carries that value-based holistic healthcare throughout his lifespan. And how do you deliver holistic healthcare? You need to be a holistic provider to deliver that kind of care. So that's what PureHealth has been actively focused on. Actually, we've very successfully managed to bring all of the verticals under one umbrella, be it our primary care, hospitals, health insurance, health tech, radiology, labs, diagnostics, research and innovation, everything under one umbrella to give an individual that entire ecosystem of value-based healthcare. So this is the reason why we've been bringing all of the different verticals to have one vision and complete integration within themselves to deliver on that mission. So let me first start with longevity, the word longevity. What does it mean to an individual? Everyone has their own take on longevity. When I ask an individual on longevity, 9 out of 10, they give me an answer, it's increasing my life. That's not longevity for us, or that's not the only aspect of longevity. Longevity is not about increasing just your lifespan. If you look historically, our lifespans have been increasing exponentially over the last decades, right? From an average mortality of 30 or about a century ago to now where we're standing, we've drastically improved. But that sick span, which is the last years of your life, whether it be 10, 5, 8, 15, those are increasing exponentially as well. Longevity for us is about increasing the health span of an individual, and automatically when you will increase the health span, that will push your lifespan further and further as well. Now, how do we plan on achieving that vision of 101 by 2071 for UAE? It's actually quite simple. We increase the quality of life, the quality of care that is delivered to an individual, thus pushing that health span further and further on the graph. And we deliver that through AI-based solutions, your integrated life coach, which guides you through that care continuum, research and innovation, our stem cell research, we're active in that, our genomics research, all of the verticals which are integrated holistically within our network to have that mission and vision. 101 by 2071. Now imagine this. If you've got a graph with an x-axis and a y-axis, and if you've got the lifespan on the x-axis, which tells you how many years an individual would live, or for that matter, the average age in UAE, say 78 years. And then you've got the y-axis, which is the quality of life, the quality of care. What we're planning to do, or what we aim to do, is to square the graph. And how do you do it? You increase the portion of healthy life, quality life that an individual spends on this planet, thus pushing the health span towards longer and longer years, thus pushing the lifespan. We're not in the business of sick care. Unfortunately, healthcare right now is accessed as sick care, reactive. You go to the hospital because you get sick, not because you want to prevent getting sick. We want to bring a hospital or healthcare, not just a hospital, healthcare to your home, on your fingertips, to proactively manage you rather than reactively. Organ donation actually sits in very nicely within our mission, No one should have to pass away from this world because they couldn't get timely access to an organ. So we at PureHealth feel very passionately about this cause. We're very humbled and privileged to be partnered with the Department of Health Abu Dhabi in order to deliver this message, to manage this organ donation unit and that entire transplant value chain, to spread this cause to the masses, to get as many people as we possibly can to understand the importance of this cause and to sign up. One organ donor has the potential to save or to extend 8 lives. 8 lives. So for me, that is such an important cause, and for PureHealth as an entity, we feel so passionately about this that we've got a large number of PureHealth team members already signing up. Do you know that less than 10% of the global organ donation needs are met? Less than 10%. Which means that 90%, so 90 out of 100 people go without timely organs. It's just, for me, it's absurd. We need to be able to access these organs. So if you would please take this as a plea from PureHealth, sign up to the organ donation platform. You will be doing yourself a favor, you will be doing humanity a favor, you will be doing mankind a favor. First of all, you need to identify what kind of an entrepreneur you are. For me, entrepreneur sits in 2 buckets. You've got an entrepreneur who's more driven by profit. So he drives his success from the dollar value, or that income statement, or his account statement from what sits in his bank. And then you've got an entrepreneur who's driven by social cause. And his success or his satisfaction comes from the impact he makes on humanity. And some would argue that you can have a hybrid of both, but not really. You need to be driven by one or the other. So my advice firstly is to be driven by that cause. Please leave this world a better place than you came into. This is a beautiful world. We have beautiful people around us and have that impact on humanity. Be the entrepreneur for cause. So that's the first one. Second, do what you feel passionate about. Do not do what someone tells you to do, or what something you feel is more appropriate to you, or what society tells you to do. I grew up in an environment where you had to be a doctor or an engineer, right? So if you're not either, then what are you doing with your life? So do what you're passionate about. When you do that, you will automatically achieve excellence. When you achieve excellence, success will automatically follow. That's the second one. And the last, and I feel the most important one, which a lot of people completely miss. You see, we have an ecosystem, an economic system that drives people to live paycheck by paycheck, which means that you plan for the next month. And there are few percentage of people that plan for the next year. My advice would be to plan for yourself for the next 10 years. So set your goal for 10 or at least minimum 5. This is where I want to be 10 years from now or 5 years from now. And these are my measures of success, and these are the objectives that I need to achieve. Work backwards from that. And you will see, when you have clarity on that vision, on what you need to be 5 years from now, you will automatically start achieving it step by step. So that's the third piece of advice. People often actually ask me what worries me, and I think to myself of, say, 40 years or 50 years down the line, on what kind of a world, what kind of system we're leaving for our next generation, and that's what worries me. You see, my youngest daughter, she's 5 years old. In the year 2062, she's going to be 44 years old. How is she going to access healthcare? It's definitely not going to be how it's accessed today. It's changing exponentially. But there's one other element that's changing exponentially, is the environment surrounding us, this planet. What kind of an environment is she going to live in? What kind of a planet are we leaving our children? That's something which really worries not just me, but all the other executives at PureHealth as well, where we are driven and we're very focused to try and make that impact on climate change. More than 10% of the GDP globally is represented by healthcare. So if healthcare doesn't actively play their part in doing something about this catastrophic changes that are going to start happening and affecting our planet, then I'm afraid we might lose the only chance of living in this beautiful planet that we have. We have just one so far, and we should take care of it for our next generations. Otherwise, your children or their children or their children are not going to really think fondly of us, will they? On what kind of an environment we left them.